it comes to defeating kidney disease in Kenya. I must say, Kenyatta National Hospital is a trendsetter, particularly when it comes to collaborations towards kidney disease, and I'm especially proud of the Kenya Renal Association, our KRA of kidneys. Dr. Ngigi and his team have done commendable job over time to be able to shine a light here. And much like Dr. Kuria, I must also appreciate the teachers who made me who I am today, Prof. Mark Ligeo, Prof. Mungai, and others who I'm seeing here in the crowd, for continuing to put their time, their effort, their dedication, their passion to defeating kidney disease. I'd like to also appreciate NHIF, and particularly the chair of NHIF. I can tell you that we have passion now, we have excitement, we have the motivation to ensure that the UHC dream is realized for all Kenyans. And so I do thank NHI for their contributions in defeating kidney disease. I'd like to appreciate the nurses, and particularly Nancy, who came and spoke to us on the role that nurses play when it comes to kidney disease. I can say when we project in terms of capacity building in the Ministry of Health, and about 9 years ago at the start of the evolution, when I was working in the district, we hardly had the numbers when it came to nephrology nurses. And I'm glad to see that now we even have associations, and we have the nurses themselves driving the agenda to ensure more and more capacity is built so that we can serve our patients. I'd like also to thank the teams who work on IACI. I do remember negotiating for IACI years ago at the East Africa Community Sectoral Council meetings. And I'm glad to hear that now we're at 90% structural completion. There was a time we used to drive down this road, and I'd always look to see what's going on in that plot. And really, over the past 2 years, Prof, there's been a lot of action there, and I'm really proud of you. Because there was a time we were worried, but now we're doing well, and this is really commendable. And I look forward, perhaps in the next 1 or 2 years, to see Kenya celebrated at the East African community, having finalized IACI and operationalized it. I do thank also IACI for the work that they've done in terms of capacity building. Today I'm here representing the minister, and as I was coming to join you today, I was trying to reflect, where are we in terms of kidney disease, and what is the message that I should pass on from the Ministry of Health today? One, I think for me, particularly as an individual, as a doctor, and as one who's been afflicted in my family with kidney disease, just last year I did have an uncle who passed away, and Dr. Ngigi was actually his doctor, and it was, end-stage renal disease and finally renal failure and death. I must say I'm especially grateful for each and every one of you who makes an effort to ensure we defeat this disease. And in that regard, then, the question becomes, where are we in terms of policy? Today I've heard each and every speaker come and share their contribution, their reflection on what we need to do when it comes to policy. And what is clear today is that we need to continue putting more efforts in improving access to kidney health services. A key element perhaps that I'm realizing we may have missed out is that of education and awareness in the general population. And I'll surprise you and tell you, yesterday I went for my annual medical checkup. Just right here next to Kenyatta, 40 suits. And when I went there for a checkup, I was surprised to learn that we actually have sodium or salt substitutes in Kenya. Do you know about that, Dr. Ngigi? Those of us who struggle with, say, hypertension, and you may be surprised to know that, yes, I am a hypertensive young girl. And my doctor was telling me, why don't you substitute the Ken salts that you use, the Magadi salts that you use, with other alternatives to try and see if you can better manage your hypertension. And when he was talking to me, because I was there with my family, I could see them surprised at, oh, there's actually a lifestyle component. There's actually a preventive promotion component when it comes to managing some of these NCDs. And we were not aware. And I wondered, what have we done particularly when it comes to policy level? Today, each and every speaker that has stood here has talked about what intervention would be needed when things go wrong. We've all gone to the extreme of the disease, when you need the transplant, when you need the dialysis, when you need the post-transplant management, when you need the diagnostics. We have not had the discussion today, and even last year when I joined you, we still have not had the discussion on how to prevent us from getting there. And every year I meet the community, every year I meet providers, every year we're engaging with people on this subject. I always ask, who has had their blood pressure measured in the past 3 months? In the room here today, I can see someone, thank you. Anyone else? Thank you. I'm afraid to ask my teachers, my professors, have we had our blood pressure measured? So there's perhaps a challenge, and this I'm putting together for myself as a duty bearer, as a policymaker, but also for the Kenya Renal Association, all societies who are working on this. Perhaps there's an element, there's a programmatic element that we need to look at when it comes to prevention and promotion. And how do we streamline it? And how does our key working partner, NHIF, also streamline this when it comes to financing for this disease? I look forward to the day where, one, even as we improve access for UHC, for poor families, and ensuring that they are registered into the subsidy program, I look forward to the day where in Kenya we will be saying we've all gone for our health checks, and that NHIF has stepped in for whatever small component, and this is a progressive journey, for whatever small component that we've stepped in that light. And so for me, as I look back and as I reflect, seeing that the burden of disease remains an issue that we need to deal with, seeing that access remains an issue that we need to deal with, seeing that risk factors remain an issue that we need to deal with, then perhaps the area that we should focus all as stakeholders in this space, even as we deal with the financing, even as we deal with the cost of care, is to then ask, how do we get to this point? How do patients move from being born, having a healthy childhood, getting into adolescence, getting into young adulthood, and then getting to the point where they now need these renal disease services? How do we reduce that number? And I'm sure if we come together, we can definitely come up with impactful programs that will be able to reduce this. As I said earlier in my introduction, in the Ministry of Health, we are passionate, we are proud of the teams who work with us when it comes to kidney disease. And as a ministry together, we've developed and rolled out training materials and clinical guidelines that touch on various NCDs, particularly diabetes, cardiovascular disease. We've been able to ensure that these guidelines get to the primary healthcare level. We've been able to ensure that countrywide healthcare workers are able to offer basic management and screening for kidney disease, and to ensure that there are also appropriate referral mechanisms. We're working together to ensure that the East African Kidney Institute will be a regional center of excellence, and that it will not only support the quality of care when it comes to service delivery for kidney diseases, but it will also serve as a training and research center. We have made investments as well as government when it comes to the Managed Equipment Service project, and it's played a crucial role. Every time we see a lot of bashing on this project, sometimes much like the plea that has been made by the chair of NHIF, I'll be making the same plea to the members of the Fourth Estate. To always have a balanced view and to be very critical, to actually come and talk to us and get that information when it comes to the success of these projects. Imagine moving from 300 patients to 6,000 on dialysis through the efforts of NHIF, but also through the efforts of government through the Managed Equipment Services project. And so again, we continue to reaffirm our commitment in providing the infrastructure and in ensuring that those benefits that patients enjoyed, reduced travel costs, reduced time, reduced congestion. I myself have witnessed this in Nyeri, the KNH Annex Center. We went for a supportive visit there last year. And I met an old man who was so grateful that we now had a dialysis unit there, and that he used to always have to come to Nairobi, but for the past 1-2 years, he's been getting his dialysis in Othaya, and he's happy. And that's what we want to see scaled across the country. Again, like we've said, in our quest for ensuring all Kenyans have financial protection under UHC, we've committed to reforms We're already there. We do thank particularly the two houses of parliament for ensuring that we now have NHIF legislation framework through the amendments that were done. And as highlighted by the chair, we are now looking at the regulations. And again, we ask you to work with us as you walk in that journey to ensure that UHC will be a reality for each and every one of us. I've had a lot of contributions, and I've often, like I said, admired the work of the Kenya Renal Association and all its stakeholders. And in the ministry, we want to take this further. We've been able to put together, for the purposes of strengthening coordination and collaboration, what we're calling the Kenya Kidney Diseases Technical Working Group. And I'm hoping, Dr. Ngigi and your team, Nancy, you'll all be members of this technical working group, because it's through this group we will be able to ensure that matters kidney disease are streamlined, are aligned, and are enshrined in terms of policy. I've heard of the disease donor program. It's piqued my curiosity, and it will be interesting, and I've just been introduced to the focal point. We'll be working on this in the Ministry of Health to see how we can actually ensure that that program comes into being. And that as a society, and I've seen this work outside of the country, that we all are duty bound, even in times where we are nearing death, and I know we all don't want to get there, but we are all living, and each day we wake up, we are dying. That's one way of looking at it. So perhaps to see what contributions we can make through that program that would go a long way in assisting our country and the citizens who would need those kidneys or those organs. I've seen that there's a need for research. I think Prof has said the word research almost 5 times when he was giving his speech. And so one of the key things we've done is to improve our health information systems in the Ministry of Health. And I'm sure IACI in of itself will probably start a registry for kidney disease. And we'll be able to leverage on these electronic investments so that we can have the information and the evidence that we need to be able to be of service to Kenyans. And as I conclude, I'd like to really appreciate and welcome the collaboration we've had with the Kenya Renal Association, Kenyatta National Hospital. I'd like to call him Dr. Gikonyo because he is a patient, but I can tell you he is a wealth of knowledge when it comes to kidney disease. I'd like to thank him. Thank you so much for that. And as the wind chases me away from the podium, thank you so much for paying attention, for listening, and for celebrating with us World Kidney Disease Day today. Let us all put effort in really eradicating this disease because it is possible. And let us remember our call to action today on ensuring that we don't get to that point where we need the dialysis. What can we do when it comes to ensuring that we are healthy and that we are actually looking at these lifestyle alternatives? Thank you so much.
Thank you, Dr. Mwangangi, for your remarks. Now we are